Is soy dangerous to eat if you're a woman and you want to avoid breast cancer? Researchers have shown that the moment that a tiny little tumor is touched by the first few blood vessels and gets fed, that tiny little tumor that was the size of a grain of rice can grow 16,000 times in just 2 weeks. A 1 centimeter tumor, the smallest thing you can feel with 2 fingers, can actually shed 2 million cancer cells into your bloodstream every single day. The difference between a harmless cancer that will never get bigger and a deadly cancer that gets bigger and bigger and bigger is, and that cancers are able to hijack this system. Like they kick in the cockpit door to hijack the plane. And what they're doing is they're actually growing selfishly blood vessels to feed themselves. This is a real problem. We can actually cut off the blood supply to tumors, starving a cancer. One bacteria seems to hold the key to your immune system tackling cancer. And that bacteria is called... Well, hello, everyone. I'm Dr. William Lee. I am here to present a special masterclass on angiogenesis and starving cancer. First, let's talk about angiogenesis. Angio, blood vessel, genesis, how they grow. This is actually the important process that forms those blood vessels when we are in the womb. And as we get to childhood, adulthood, and into our later years, this process of angiogenesis is one of the most important defense systems that protects our health in our body. Our body contains 60,000 miles worth of blood vessels packed under our skin. These are the highways and byways that deliver the oxygen that we breathe, the nutrients that we eat, and if you're sick and your doctor prescribes a medicine, the medicines have to go through the blood vessels to get to where they need to go to heal you. Now, how extensive is 60,000 miles? Well, if you were to pull out all the blood vessels and line them up end to end, you would actually form a ribbon that would encircle the earth twice. What are these blood vessels doing? But let me tell you at a deeper level. And don't worry, I'm going to get to the cancer part shortly, how you can starve cancers, but I need to explain to you what these blood vessels are actually doing. You can see on the left this loop of a blood vessel. We call it a capillary, finer than a human hair. It's delivering oxygen and removing metabolic waste. At the tips of these blood vessels are cells called endothelial cells. Endothelial cells are basically the cells that line the blood vessel on the inside, kind of like the tiles in a kitchen. They're just lining the walls, and each of these endothelial cells will spray out protein factors called survival factors that keep the tissues next to the blood vessels alive. Oxygen, nutrients, remove metabolic waste, delivery of survival factors. You can imagine how important this would be for healthy tissue. In fact, so important that every month in a woman who's of reproductive age, blood vessels are growing through angiogenesis in the walls of the uterus. That's the endometrium. That's what happens every single month. The womb grows this nest of blood vessels preparing to receive a fertilized egg. If there's pregnancy, tissue will continue to grow. If there's not, this whole lining of blood vessels gets sloughed off during menstruation. Other time that angiogenesis is absolutely clear that you will see it is if you are injured and you fall or you have surgery. So you remember when you slipped on the road, skin your knee, or maybe you had surgery. As in this picture here, the surgeon cuts right in. The body has to heal itself, right? You get a scab that forms, but if the scab falls off too early, we've all had that. This is what you see on the right-hand side. You see this bubbling tissue underneath the scab. Guess what that is? Angiogenesis. New blood vessels growing up to deliver oxygen and nutrients to heal the wound. But what happens when you have too many blood vessels, not enough blood vessels? Well, this is actually where you have a problem. Not enough blood vessels, you have wounds that don't heal. Your heart doesn't get enough oxygen. Your legs don't get enough oxygen. Might need an amputation. After a stroke, your brain might not get enough oxygen if you don't have enough angiogenesis. And nerves can actually die. We call those neuropathies if you don't have enough blood vessels. This is just some of the problems that can occur if you don't have enough. All right. And the treatment, the goal of the body is actually to grow more blood vessels, pro-angiogenesis, and normally can actually do it well enough. All right. What about the other side of the equation? And this is where we're going to get to cancer. Too many blood vessels is a very dangerous thing. You might say, how can the delivery of oxygen be dangerous? Well, new blood vessels grow and feed diseased tissue, and they cause scarring, and they can leak and damage tissues. Even obesity, if you look at the bottom, body fat, remember, growing near blood vessels will expand, get bigger, bigger, bigger. A mass of fat actually has a lot of blood vessels in it. Just ask your friendly neighborhood surgeon when they cut into a body with a scalpel. If there's a lot of body fat, there's a lot of bleeding because there's a lot of blood vessels. Alzheimer's disease, too many blood vessels that don't do their job in the brain. They deliver toxin. In the lung, pulmonary fibrosis, too many blood vessels growing and causing scarring, endometriosis. All right, I'm saving the most important for last, which is cancer, which is what we're here to talk about. Too many blood vessels can feed cancer. And if you haven't heard of this term, we call it tumor angiogenesis. Tumor angiogenesis. Obviously, not normal angiogenesis, obviously, blood vessels out of balance feeding the cancer. Decades ago, in the early 1970s, a surgeon named Judah Folkman implanted cancers in the backs of animals to see what would happen. And what he realized is that if the tumors were white little tumors and they stayed small, they would never grow up. But the moment that the tumors started to grow up and get large, guess what? They were covered with blood vessels that penetrated them. Now, at the time, nobody knew that blood vessels could grow. No one knew how they did grow. And so that's how this whole field, this landmark pioneering field of angiogenesis started. The difference between a harmless cancer that will never get bigger than a tiny little grain of rice, like you can see here, and a deadly cancer that gets bigger and bigger and bigger is angiogenesis. Tumor angiogenesis is the trigger that makes cancers dangerous and deadly. What's really interesting is that you can cut these tumors out and you can purify the stuff that the cancer is making, because at the time nobody knew what was the fertilizer that the tumors were making, the cancer cells were making, in order to attract blood vessels to them. So what did the researchers do? They took the extract, the fertilizer, out of the tumor. Nobody knew what it was at that time. Now we know. And they would actually mix it into a polymer, okay, a little piece of plastic. And then using microsurgery, and I took part in this as well, we would implant that little piece of plastic that was filled with these tumor proteins, these fertilizers for angiogenesis from the cancer, and we would slide it into the cornea of a rabbit. Now, the cornea is like the crystal clear face of a watch. So if you still wear a watch, most of us have phones now, but if you have a watch, you'll know that the glass piece on top of it is crystal clear. If there was anything inside that glass, you wouldn't be able to tell the time, right? Well, what do you think happens once you actually implant the fertilizer into this plastic piece of plastic that you slide into the cornea, and the tumor factors begin to diffuse out? You got it. Blood vessels are attracted. Tumor angiogenesis begins to occur, and they grow right up towards and into that implant. And in fact, that's how we understand how cancers grow now. You start actually from, on the far left, a harmless, tiny little tumor that'll never hurt anybody. It's like a pimple that forms on your back. You'll never see it. It'll never cause a problem. It'll go away all by itself. That's how most cancers are. All right. In fact, we form mutations that can become cancers, about 10,000 of them every single day. They never become harmful. Our immune system will see that little tiny little guy. I'm going to come to the immune system in a little bit, and they just wipe them out. And that's because the little tumors don't have a blood supply. Now, and we call it the pre-vascular stage of cancer. No blood vessels, no vessels. Now, over time, months or years, some of the cancers can begin to produce those fertilizers seen here in little green balls. And once they diffuse out, just like in the cornea I showed you, they'll begin to attract, like fertilizers, new blood vessels that will grow up towards and into the tumor, touching the tumor, feeding the tumor, bringing the oxygen. And all of a sudden, this vascularized tumor is now being fed by blood vessels. And researchers have shown that The moment that a tiny little tumor is touched by the first few blood vessels and gets fed, that tiny little tumor that was the size of a grain of rice can grow 16,000 times in just 2 weeks. All right. Again, angiogenesis out of control is a trigger to make a harmless cancer into a deadly one. This is an X-ray and of a breast that has a cancer in it, and you see that white area that's kind of like right in front, like right in the middle. Okay, and look at all the blood vessels. The reason you can see the blood vessels here in an X-ray is because they've got calcium on them. This is an older person that has, hardened blood vessels, hardening of the arteries, and guess what? Even the tumor blood vessels are lighting up. You see all those blood vessels feeding that cancer. Now, how big is a tumor like this? Well, the smallest tumor that you can feel on a self-exam, like women are taught to do by their doctor, is 1 centimeter in diameter. I want to tell you what's in a 1 centimeter tumor. A 1 centimeter tumor, the smallest thing you can feel with 2 fingers in the shower, already contains 1 billion cancer cells. Wow. And in order to support 1 billion cancer cells, 10 to 100 million blood vessels have to grow into it, as I've shown you, in order to support it. And those same blood vessels that feed the cancer can form escape channels for cancer cells to escape into the circulation. How many get out from that primary tumor into the bloodstream every 24 hours? 2 million. So a 1 centimeter tumor, all right, less than half an inch, has 1 billion cancer cells. In order to survive, to survive at that size, you need up to 100 million blood vessel cells caused by tumor angiogenesis. That's angiogenesis out of balance. And that can actually shed 2 million cancer cells into your bloodstream every single day. Wow. Amazing, right? Really eye-opening. Okay. Everybody knows, how do you treat cancer? You treat it with chemotherapy. Chemotherapy kills cancer cells. Chemotherapy kills normally dividing cells. That's why you get side effects. Kill the cancer, but you also kill some normal healthy tissue as well. Anti-angiogenic therapies will knock out just the blood vessel. Take an anti-angiogenic approach treating cancer. You are starving a cancer by cutting off its blood supply. It doesn't harm normal tissues. It only harms those terribly constructed blood vessel. All right. Here's what's interesting. Chemotherapy can also knock out newly sprouting vessel. Now, we've now known that if you take chemotherapy, which is usually given at a very high dose, lower the dose, down, 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 down. It's called low dose chemotherapy. You won't actually kill the cancer cells. You won't have much toxicity. You'll knock out the blood vessels. New way of using chemotherapy that's starting to become used by oncologists as well. All right. Again, I'm giving you theory, but I hope I'm making the point of just how important blood vessels are and why they're dangerous for cancers. And now I'm showing you what we can do about it. Now I want to show you some research that I've been involved with that shows you how to do this in real life. Okay. So some years ago, I was involved with a research project to develop a model system, meaning how do you study angiogenesis? So what you're looking at on the left-hand side here is a ring. That ring is a gigantic blood vessel in the body called the aorta. In this case, it's a mouse. It's not gigantic. It's inside the body of a mouse. And inside the lining of that blood vessel, on the inside of it, you're looking at an eagle's eye view of it, are the endothelial cells. Those are the tiles, the cellular tiles that line the inside of a blood vessel. And guess what? They're growing inside a plastic dish. And when you drop a little bit of that fertilizer made by cancers, okay, into the liquid that it's growing in the bath, what's going to happen? Boom. The blood vessels and the endothelium wake up and they sprout out in a starburst configuration. It's like a supernova. They grow, blood vessels spring out. Look at the tubes. If you look really closely, you'll see that this is not just an explosion. It's actually a network of tubes that are growing out. Now, on the right-hand side, we and other people were testing drugs. We developed drugs that could starve cancers by cutting off their blood supply. And I'm showing you an example of one test system where we've dropped in a medicine called TNP-47. Guess what? No more blood vessels. Cut off the blood supply that would have been feeding a cancer, right? Pretty cool. Now, the question is, if it works in a lab, does it work in people? Let me show you. This is actually a patient, one of the first with cancer that responded to cancer-starving treatment and anti-angiogenic therapy. This patient was in her 40s. She had cervical cancer of the cervix that had spread all over the place, including in her lungs. So on the left-hand side, you're actually looking at a CT scan. And what you're looking at is basically like a deli slice picture of a person. The white oval in the center is her heart. The semicircles around the edges are her ribs. On the lower side at 6 o'clock, spine, and you can see two little white lumps up there. She had breast implants. So and the black area is her lungs. They should be completely clear, all black. Look at all those little white spicules in there. That is the cancer that's spread to her lungs. This individual got an anti-angiogenic cancer-starving treatment. Okay. In fact, the same one that I showed you in the test substance before, where it knocked out all the blood vessels from the ring. And guess what? 18 weeks later, look at her lungs. Cancer's gone. Cancer was starved by cutting off the blood supply. This was published in the New England Journal of Medicine in 1998. First cancer patient to benefit from an anti-angiogenic therapy. This is biotech. All right. And this is something I've been involved with. Cervical cancer. Same thing can be achieved with breast cancer, starving a cancer. Obviously, breasts on the left-hand side, you can kind of see that white halo, blood vessels growing around the tube. This is a special kind of image that shows, two breasts hanging downwards, and you take an image of it by looking straight onto it. You can see the cancer with blood vessels creating this white halo around it. Okay. Got a medicine, an anti-angiogenic medicine called Avast. Look at that. After several treatments, no more angiogenic ring, no more cancer. Starve a tumor by cutting off a blood supply. Here's another one. This is a little bit more graphic, but on the left-hand side is a rectal carcinoma, colorectal cancer. Probably have heard about it. It's one of the fastest growing cancers, younger populations. This is when you get a colonoscopy, this is what the doctor sees. Each of these pictures is what you would see inside the periscope of the colonoscope. And you see that little snake-like looking thing with the red kind of web around it. That is a rectal cancer, okay? And this patient got Avastin, anti-angiogenic cancer-starving biotech treatment. 7 weeks later, look at that. It's gone, right? Pretty amazing that this actually works in people. I've shown you animals. I've shown you tissue culture in plastic in the lab. Now I'm showing one after another. All right, so anti-angiogenic therapy is an amazing approach to treating cancer. We know it works with drugs. My organization at the Angiogenesis Foundation about 15 years ago, we decided to use the same for studying and developing drugs, biotech treatments like cancer-starving drugs, and we started to study food. Now, why did we study food? Well, because, by the way, so these are the treatments that the patient received: anti-angiogenesis with some chemotherapy, with some radiation. This is not throwing the baby out with the bathwater. We use whatever tools we need. This is the mixed martial arts, MMA, of cancer treatments. You just want to get rid of the cancer. So this is not about throwing out everything. This is using everything judiciously to get the result we want. Okay, my organization decided to see if this same approach could be achieved with food. We've got some real powerful science, like I was showing you earlier. And in fact, we can apply the science by going to the farmer's market and picking foods that we want to study to see if they will have an anti-angiogenic effect. All right. So we can pop extracts from foods into the same system and see if we're actually shrinking back those blood vessels, right? Does it work? Well, I'm going to show you the results of a series of studies we've done to compare pharmaceuticals with pharmaceuticals. That's pharmaceuticals with an F, plants, to look for the potency to shrink down those blood vessels, okay? And here are the results. Look at this. Turmeric, green tea, lavender, citrus, brassica, broccoli, red grapes, garlic, soy, berries, parsley. You can kind of see why my jaw dropped when we got these results, because this is really the best example that I had ever seen of food as medicine. That's food tested in a system in which we test medicines, right? You're looking at this right now. The shorter the line, the bar, the more powerful the drug. And look here, common dietary factors from foods stack up head to head against some of the drugs. So I want to show you what we're actually seeing. For example, like you probably recognize edamame beans, right? That's soybeans. Well, we can actually put an extract of soybeans in this same system, and guess what happens? Boom, anti-cancer starving. That is right. Soybeans and soy foods can actually cut off the blood cancer. Now, some of you might say, wait a minute. I know for a fact that if you've got breast cancer, you don't want to be near soy, right? Wrong. That is an urban legend, and I'm going to prove it to you right now. It is true that soybeans and soy foods have a phytoestrogen. It's called genistein, and this is what the chemical structure looks like. Phytoestrogen. So this is why someone some years back said, well, if it's got an estrogen, phytoestrogen, and we know some human breast cancers are sensitive to estrogen, maybe they should stay away from soy. That's the origin of this urban legend. But now let's take a look at the chemical structure of human estrogen. Does that look anything like the soy, the phytoestrogen? No. Human estrogen and soy estrogen are completely different. And in fact, soy estrogen will block human estrogen like Mother Nature's tamoxifen. So, is soy dangerous to eat if you're a woman and you want to avoid breast cancer? No, totally not. All right. Now, you might say, okay, but I'm still not taking the chance, right? I mean, why? That's theory. It's chemistry. I don't want to. I don't want to even go there. Well, let's take a look at what happens in humans. This is a study of 5,000 women in the Shanghai Breast Cancer Survival Study, and they looked at women who actually were at the highest risk for breast cancer, meaning these women who already had breast cancer, and found that those women who ate the most soy, had an almost 30% decrease in the risk of death. And if they already had their cancer treated, they had a 32% decrease in the risk of having the cancer come back. Completely not what the urban legend says. Eating soy is not just not neutral, it actually lowers the risk of breast cancer. Why? Because it's cutting off the blood supply, feeding the cancer, starving the cancer. Eat the soy, starve the cancer, and breast cancer, it benefits people. All right. How much soy do you need? About 10 grams a day. And how much is 10 grams a day of soy? That's about one tall glass of soy milk, easily attainable. If food is medicine, medicines have doses. This is the type of research that I do to look at the foods, their effects, and their doses. Now, somebody critical might say, well, you're just showing me one study. I'm not going to take a chance on that. All right, good point. Here are 14 studies of breast cancer and soy looking at survival versus death. What about tomatoes? Tomatoes have a natural compound called lycopene. Some of you may have heard of tomatoes have lectins. Tomatoes are nightshades. All urban legends. Okay, they are not harmful. They're actually good for you, and I'm about to show you why. Lycopene is an anti-angiogenic substance, and in fact, lycopene will inhibit the ring that I talked to you about earlier. Okay, and when that lycopene in a tomato cuts off the blood supply to tumors, this has been studied in humans. This is the Health Professionals Follow-Up Study, more than 40,000 men. They found that those men who ate 2 to 3 servings of cooked tomatoes every week had a reduced risk of developing prostate cancer by about 30%. Eating more tomatoes with lycopenes cut off the blood supply, feeding prostate cancer, lowers the risk of the cancer becoming dangerous, just like I showed you earlier. And in fact, what they found is that the more tomato sauce they ate, the smaller the area of the blood vessels feeding the cancer, and the vessels became more normal. All right. So this is actually looking in people themselves, looking at the blood vessels in the tumor. What's really interesting is how do you get more out of a tomato? Remember, I told you that in that study, they looked at cooked tomatoes. Well, that's because when you simmer tomatoes, okay, simmering tomatoes like a grandmother does, you're actually changing the chemical structure of the lycopene into a form that your body loves to absorb. So you get more of the good stuff to starve cancers when you cook the tomatoes. In fact, you get 50% more if you simmer it for 2 minutes and 250% more when you simmer tomatoes for 30 minutes. And because lycopene is what we call fat soluble, it likes to dissolve in fat. If you really want to get the most bang for your buck when it comes to lycopene and tomatoes, you should saute those tomatoes in something oily like extra virgin olive oil. What's the most potent of each type of food? So these are the tomatoes that have really high levels of lycopene, the San Marzano tomato from Italy, the cherry tomato, the tangerine tomato, has a lot of bioavailable lycopene, and black tomato also has a lot of lycopene. Pretty cool, right? Okay, very practical too. And here is a list of cancer-starving anti-angiogenic foods. Partial list. In my book, Eat to Beat Disease, I have longer lists like this if you want to read that book. But this is the work of the Angiogenesis Foundation, collecting, studying, looking at, critiquing all the foods that have anti-angiogenic cancer-starving properties. Polyphenols in plant-based foods, fruits and vegetables, and herbs and spices can fight cancers not only with anti-angiogenics as cancer starving, but they can also do other things like wipe out cancer stem cells. What's a cancer stem cell? Well, look, in that big tumor that I showed you, there's little baby cancer cells that are stem cells that even after you hit the cancer with chemotherapy, a few of those little cells will still survive. Those are stem cells. And what do stem cells do? They grow cancers back. So if you have an initial tumor, the first tumor, you treat it with chemo, most of the cancer cells will die. The ones that survive are cancer stem cells, and they'll just grow the tumor right back. Not good, right? So one of the holy grails of cancer researchers is to find a way to get rid of cancer stem cells. Well, I can tell you as a cancer researcher myself, we haven't figured out how to develop a drug to knock out cancer stem cells. But Mother Nature is much smarter than we are, and Mother Nature has already made foods, many of them anti-angiogenic foods that can starve a cancer. They also, with their polyphenols, kill cancer stem cells. Purple potatoes, dark chocolate, extra virgin olive oil, capers, thyme, walnuts, green tea. These all kill the stem cells of colon cancer, breast cancer, prostate cancer. Quite amazing that the research is showing that foods can actually tackle and knock out cancer stem cells. We don't have a drug to do it. Mother Nature has foods that we can actually that can actually achieve some of the things that we want to have happen. We don't have drugs for. Now, some of you may have heard what immunotherapy is. I will tell you if you haven't. It is the most advanced cancer treatment out there. It's so amazing because this is a treatment that is not chemo, not radiation, not surgery, not even anti-angiogenic. What it does is these treatments boost your body's own immune systems. If you remember at the very beginning, I told you those small, tiny little pimple-like cancers never become dangerous because your immune system wings by like soldiers, like cops on a beat driving by. They knock them right out, take all those bad guys away. All right. And that's your immune system. So immunotherapy is just giving your immune system a supercharge to be able to knock out cancer cells. And it is working in ways that we had never imagined possible. For example, on the left is a scan of a brain of a person with melanoma, and the melanoma from overexposure to the sun spread to the brain. You see that red circle there on the left-hand side, that little white, that sort of 3 or 4 white balls, that's cancer that's spread. You bet there's a lot of angiogenesis feeding those cancers. And this is before treatment. Give the patient some immunotherapy, boost their own immune system, the T cells, natural killer cells, dendritic cells. These are the cells that actually knock out cancer. And wow, look on the right-hand side. The patient's own immune system knocked out the cancer. All right. And this is what we're actually seeing. But it only works in about 20% of people. And so we've been asking the question, why do some people respond beautifully and other people don't respond at all? Well, it turns out that there is a bacteria in your gut. Many of you have heard of gut health, gut bacteria, gut microbiome. It's connected to cancer. One bacteria seems to hold the key to your immune system tackling cancer. And that bacteria on the lower right is called Akkermansia muciniphila. Akkermansia bacteria that will actually help boost your immune system to fight cancer. And it turns out that what we eat help our gut grow more Akkermansia, grow more of this bacteria that our immune system wants to actually be able to go to town and knock out that cancer. So polyphenols starve the cancer, kill cancer stem cells, boost immunity. All right. Help grow the organisms that we want, healthy bacteria. And by the way, for Akkermansia, it's not just pomegranates that can do it. Cranberries can do it as well. Concord grapes can do it. Peach juice can also do it as well. All of these starve cancer, grow healthy gut bacteria, improve your immune system. If anybody is now doubting that food is medicine is important, you can leave now, okay? Because I think I've made a pretty good point. So I'm just going to close by quoting the Nobel laureate Albert Szent-Györgyi, who once said that discovery consists of everything we've seen and thinking what no one has thought. I hope after this, I've actually given you a brand new way of looking at food as medicine and thinking about your circulation as something that's so important for health, but so important to keep under control. And if we eat the right foods to help our body keep that under control, just the right amount of angiogenesis, it's a way of preventing cancer. And it's also a way of helping our body and helping our doctors, the medical community, fight and beat the cancer as well. Hey, if you like that video, then you're going to love this one. Check it out.